A lactating woman present with acute breast pain, swelling and fever, the most likely organism is. Correct answer is option B, Staphylococcus. Inflammation or infection of the oviduct is called. Correct answer is option B, Salpingitis. When the mature ovum leaves the ovary, it is caught by the. Correct answer is option B, Fimbriae. What is the presumed cause of antepartum hemorrhage in placenta previa? Correct answer is option B, decidual vessel rupture. The most common cause of postpartum hemorrhage is. Correct answer is option C, uterine atony. A non-stress test is considered reactive if there are. Correct answer is option C, 2 accelerations in 20 minutes. Which hormone is primarily responsible for milk letdown? Correct answer is option B, oxytocin. In eclampsia, what is the first line anticonvulsant? Correct answer is option C, magnesium sulfate. In a pre-migravida, the earliest detectable fetal heart sound by Doppler is around. Correct answer is option C, 10 weeks. Which of the following is contraindicated in pregnancy? Correct answer is option B, warfarin. A patient complains of cyclical pelvic pain, dysmenorrhea and infertility. The likely diagnosis is. Correct answer is option A, endometriosis. Which of these is a risk factor for gestational diabetes mellitus? Correct answer is option C, family history of diabetes. At what gestational age is Rh immunoglobulin prophylaxis typically given? Correct answer is option C, 28 weeks. The best next step in managing a woman in preterm labor at 32 weeks is. Correct answer is option C, tocolectis plus corticosteroids. A leiomyoma is more commonly known as. Correct answer is option C, uterine fibroid. In asymptomatic bacteriuria in pregnancy, the best management is. Correct answer is option C, culture-guided antibiotic therapy. What is the most common site for ectopic pregnancy? Correct answer is option C, ampulla of fallopian tube. Oligohydramnios is defined as amniotic fluid index less than. Correct answer is option A, 5 cm. Which of the following is contraindicated in active genital herpes outbreak at term? Correct answer is option C, vaginal delivery. Which method is most effective for contraceptive failure in an emergency? Correct answer is option C, copper IUD insertion. The first step in the evaluation of abnormal uterine bleeding is. Correct answer is option C, pregnancy test. In cervical cancer screening, the HPV test detects. Correct answer is option C, viral DNA. Which of these is a symptom of ovarian torsion? Correct answer is option C, severe sudden unilateral abdominal pain. The cause of preterm premature rupture of membranes most often is. Correct answer is option C, infection. A patient with placenta abruption typically present with. Correct answer is option C. Sharp abdominal pain plus uterine tenderness. Which of these is associated with choriocarcinoma? Correct answer is option A. Haldatidiform mole. What is the cause of eclampsia seizures? Correct answer is option C. Cerebral edema. A placenta implanted low but not covering internal edge is called. Correct answer is option C. Low-lying placenta. What is the presumed cause of antepartum hemorrhage in placenta previa? Correct answer is option A. Decidual vessel rupture.